In Dorset, the system-wide co-production project is centred on improving the experience of both patients and carers who were discharged from hospital using the discharge to assess model. A previous engagement project told us that the experience has not always been positive, but also that carers had a lot of ideas for improvements and were keen to work alongside staff to identify and put in place solutions. We structured the work in two distinct pathways, together co-designing improvements to real on-the-ground challenges, as well as working with the Home First programme leadership to embed lived experience within the existing governance structures. Underpinning both of those parts is the need to work alongside people with both lived and learned experience to explore and develop their understanding and skills in co-production. One of the things that we have learned during this project is that co-production works to its own timeline, and rushing risks leaving people behind. So today we present some of our progress and learning from part 1 of our co-production journey, whilst being full of excitement to see it continue.
I was involved with 2 experts by experience, and we worked together so that everything we were doing throughout the project was having a carer input, a carer's point of view, a carer's perspective. The lanyards were one of the things one of the experts by experience was really passionate about, and they're in place and we're using them.
I worked with another carer, and there was a range of questions that went out both to the hospital staff and to carers as well, so we had a view from both. Staff thought it was quite easy to identify carers, others carers perhaps felt they weren't identified.
We were asked to help get feedback from patients who have recently been discharged from our community hospitals. It definitely made us aware that there are things that volunteers could help with. They could help more with communication with the carers, understanding what will happen next for patients when they leave the hospital, getting patients ready for that change when they're going home, so being able to adapt to the home life from hospital. It made us think about what volunteers could do to support with that, and we're taking that forward in our volunteer strategy. Dorset Healthcare, Dorset County and UHD wanted to come together to create our Dorset version so that all Dorset carers would recognise the passport and know what benefits they would be entitled to. It was really good to have the carers by experience on board in the project, because that actually helped us a little bit with the passport and helped us to get the passport moving.
I really enjoyed being part of it. I felt very valued. Staff would ask questions, and we were both given the opportunity to have an area to work on ourselves.
I felt well supported and welcomed by Dorset Healthcare staff, and the feeling that I'm valued.
Bringing a lived experience, things in a whole different, potentially a whole different view of the project you're working on.
I think it's vital. The evidence suggests that when clients and their carers are involved in planning a service, there's better all-round satisfaction.
Getting a project, getting an end product right from the beginning, so that you get to the end result knowing that the right people have been involved and you've had the right feedback.
Sometimes we can think of cheaper ways of doing things and identify and get rid of some of the things that were not helpful.
The tricky thing for me was managing sort of expectations, because when you work in a trust, you know things don't happen overnight, things take a while to embed.
Selling the idea to the councils and acutes has been less encouraging. They do not see why they should pay us. But if we are all equal in the room, not paying all the attendees makes equality unachievable.
Get discharge working better for carers in hospital. Really, a carer's journey starts at the beginning of an admission, so it's making sure that carers are equipped from the start with the right things.
I'm hoping that we can be involved in the assessment of the service on a regular basis. In order to do this effectively, we need to be able to talk to some of the people who've had that direct experience of it. Part of co-production needs to be succession planning. We need to recruit people from different backgrounds, age groups and ethnic minorities to take over the baton in the future.
We're very passionate about what we do. Sharing a lived experience can be quite difficult at times, but we do it because we live in hope that simple changes can make a difference to everybody across the board.